August is National Minority Donor Awareness Month, a time when we bring awareness to the importance of organ and tissue donation in our minority communities. And this year we are celebrating 25 years of this holiday. So we are very excited at LifeLink to be able to highlight during this month specific topics that do affect our minority communities. And this morning, we are excited to have with us Dr. Tamorie Smith. She is a nephrologist with Renal Associates, LLC. How are you today, Dr. Smith?
Great. I'm great. Thank you, Kendra. How are you?
I'm great. Do you mind sharing with us a little bit more about yourself?
Sure. So as you said, I'm a nephrologist practicing here in Columbus with Renal Associates. I was trained at UAB. That's where I did my residency and fellowship in nephrology, residency in internal medicine, of course. And then after that, I joined the practice here, and I've been here in Columbus since 2009 in private practice, obviously servicing all of the hospitals in the area as well as the dialysis facilities affiliated here in town, majority with DaVita Dialysis.
Awesome. So let's jump right in because the purpose of our discussion today really is to talk about kidney health. As you know, the majority of people that are waiting right now for organs, not only in the state of Georgia, but in our country, are waiting for kidneys. Why is it that you think kidney disease is so prevalent in our minority communities?
That is a very complex issue, to be honest with you, Kendra, and there are so many layers of it. But just to scratch the surface, of course, you know, there are healthcare disparities that affect minorities to a large extent. Access to healthcare. The diseases that cause kidney disease, you're talking about your diabetes, your hypertension, these things that are uncontrolled, your atherosclerotic disease. These disease processes are worse in patients who have delayed healthcare or limited access to healthcare. And that very much affects minority communities. The disease process becomes worse when they're not attended to and not controlled well. And that increases your risk or the rapidness in which you will progress to chronic kidney disease and eventually potentially end-stage renal disease. And so that's why the minority population is so heavily affected.
Gotcha. And we talk a lot about health disparities in our community, and that's something that will be a theme throughout our discussions this month as our viewers on social media are kind of watching some of our videos. Like when do you need to be concerned, you know, about your kidney health?
So it's so difficult to tell because it's not like there will necessarily be signs that the layman would recognize. And so it's important to be proactive. It's important to have a primary care doctor. You don't have to have chronic medical problems to have a primary care doctor. Most people need a yearly evaluation just to make sure that there are no issues going on, especially if you have risk factors like family history, risk factors like obesity, risk factors like high cholesterol, things of that nature, a poor diet. All of these things increase the risk of you developing chronic issues and having no idea about it unless you're proactive and unless you're getting yourself checked and having routine yearly checkups in labs. And so it's hard to tell a person when should you be concerned because people think that, well, maybe I would have problems urinating, or maybe I would notice my urine would be less or less frequent or look different. And guess what? It may not. I have patients on dialysis who still urinate. And so this is not the sign that you want to look for. You really need to be proactive and get yourself checked by a primary general practitioner, at least on a yearly or every other yearly basis, depending on your risk factors and your health. Because oftentimes labs are what's needed to actually see and know what's going on with your kidneys.
That makes sense. And a lot of people that I hear say, if I have high blood pressure, if I have high cholesterol, I'm more predisposed maybe to having some of the some issues with my kidney, and that may prompt me to ask some of those more probing questions of my primary care physician. Do you agree with that?
100%. So I think that if you have these conditions, hypertension, hyperlipidemia, diabetes, especially, if you have any of those things, number one, you want to make sure they're well controlled. So make sure you've educated yourself on what it's going to take to control these issues. Number two, you want to make sure you're communicating and have a comfortable relationship with your primary care doctor so that you are comfortable enough to ask questions. You want to ask them, are my numbers good? What are my numbers? When we talk about numbers, what are you talking about? You know, so you want to make sure that your blood pressure is controlled. The systolic, which is the top number, and the diastolic are in range of what's recommended. You want to make sure your cholesterol is controlled. The good and the bad, because there are different numbers that as physicians we look at in a lipid panel. You want to make sure that your electrolytes and your creatinine is the number in the labs that we check to help us estimate the kidney function. You want to make sure that's in a normal range. Those are the questions that you want to make sure when you have your doctor's appointments that you're asking, and you're making sure that those things are where they need to be.
That's awesome. So for those that are watching, hopefully they took notes on those things and they can go back and ask their doctor next time they're there. So when do I need to see a nephrologist? What's the difference between?
Yeah. So as a nephrologist, as I said before, I am internal medicine trained, but I personally, myself and my partners, we don't practice as primary care physicians. So we are specialists. And so we see people who specifically have kidney issues or resistant hypertension or electrolyte abnormalities, things that are pertinent to the kidney specifically. And so up until the kidney disease reaches a certain level, oftentimes the primary care doctor is comfortable managing things when you have earlier CKD, stage 1, stage 2. It's typically when a person progresses to stage 3, or if they are stage 2 and have some risk factors that are concerning. Those are usually the times that the primary care doctor would feel the need to refer. Now, I do have patients who come to me at stage 1, but those are typically patients who have different medical issues, not related just to primary issues, but a primary renal glomerular disease. And so that's sort of a different type of category. And it's really up to the discretion of the primary care doctor. Depending on that doctor, they have a comfort level along whatever range dealing with the kidneys. And so a conversation with your doctor. I have some patients whose doctor feels comfortable dealing with early chronic kidney disease, but the patient themselves said, you know, I would feel better if I saw a nephrologist, and that's fine. And the doctor then referred them. So it's really important, in my opinion, to have a good conversation and a good relationship with your primary care doctor. That's the first step, and that's important.
Great. One thing that we hear a lot as I'm out in the community educating on the importance of just becoming a donor and helping provide the informed information so people can make a decision one way or the other about becoming an organ donor. One thing we do run across as well is just educating people that are on dialysis and are potentially in need of a kidney. We find that a lot of times people either don't get the information, or maybe they're afraid of having surgery. So if there are people here, if there are people watching, they're on dialysis, what are your thoughts as a nephrologist on should they get on the waiting list to get a kidney or not?
So that is a resounding yes, 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 yes. And I would say talk to your nephrologist, talk to the social worker at your clinic. There is a huge push by the dialysis providers, meaning the Fresenius, the DaVitas, the US Renal Cares, all those providers out there are motivated to help these people get the education. The education is right there. We have social workers, we have dietitians, we have people, nurses, we have people in our clinics who are specifically educated to do that education. They have the materials, they have all of that, because we have identified that it is life-changing, life-saving. Organ transplantation, kidney specifically, obviously. Patients who remain on dialysis versus patients who get a transplant. The transplant patient is going to have a longer life in general. That has been shown time after time. I have patients personally who say, well, Dr. Smith, I'm doing okay on dialysis. I'm feeling good. My lifestyle is good. I get it. And that is my goal. My goal is that if you have to do dialysis, that your quality of life is as good as we can get it. However, it will never be as good as that kidney that God gave you to begin with. And so a transplant is always, if it's possible, that's always my recommendation. Now, there are some situations that a person is not a candidate. And if they've gone through the process and if they're not a candidate, then absolutely, we want to give you the best quality of life on dialysis that we can. But if you are a candidate, I strongly recommend a transplant.
Awesome. Well, this has been great. I was going to ask one more thing. Is there a website that you direct those types of patients to get more information, to get on the waiting list or learn more about getting a transplant? Where do you normally direct your patients?
So to be honest with you, if a person is already on dialysis, then I direct them to their dialysis clinic and their nephrologist, because that is the most direct route. That is where the referral comes from, and they are referred directly to the transplant center themselves. Now, you can always find information on the National Kidney Foundation website, NKF, and so that's out there, and there's plenty of information there. Each dialysis provider has information on their specific website. So DaVita has information, davita.com. But once again, the first step, reach out to your social workers in your clinics. That person has ample information. You know, not everyone is computer savvy, Kendra. And so we have a lot of older patients who are not as comfortable on the computer, and that's fine. We have paper, black and white printed paper that we can still give patients, you know. I know we're in the computer era, but we actually do still print things. And so they can get something in their hands that they can go home and read over. They can share it with their families. They can think about it. And if they're still scared, have a discussion with your nephrologist. I can't stress that enough. We are here for a reason. We are here for a purpose. We don't throw you away when we start you on dialysis. We are still your doctors. We're still your advocates. We still want to help you. And so I just encourage them to reach out to us.
Awesome. Well, this has been great. I hope that those watching got something out of this today.
Absolutely.
Dr. Smith, we thank you for your time. And for those that are interested in potentially registering to be an organ donor or just learning more about it, you can go to lifelinkfoundation.org. That's lifelinkfoundation.org to register to become an organ donor or to learn more about what it means to be an organ donor. So thank you again, Dr. Smith.
Absolutely. My pleasure. Thank you for inviting me.
No problem. And happy National Minority Donor Week.
Yes, absolutely. You too.
Thank you.
Yes, ma'am.